Exactly.
Just a couple other areas to touch on, respect your time. There was a recent, fairly well popularized blog written by two medical students, and I don't have the title, but took exception with the classic presentation. I have a 68-year-old African American female who presented with shortness of breath, and that there's implicit bias that we didn't say 69-year-old person. I don't think they were taking exception with the comment on the gender, but they were taking exception with the term Black or African American, that it immediately oriented people to have certain thoughts that were not appropriate to their optimal patient care. Just a couple comments on that. It was kind of a hot, angry editorial.
It's a lot to say, and if it wasn't for the ApoL1 gene, which not everybody on the audience is going to know that encodes for more chronic kidney disease, which, by the way, would be eliminated if people didn't eat animal protein. And if people don't believe me, just put it in your search engine. You'll see animal protein, chronic kidney disease. You won't believe that people are still feeding animal protein to people with kidney disease. That would be one. The next one would be the valine in transthyretin, so that the older Black men tend to get that mutation, tend to get amyloid heart disease. Another one, of course, would be sickle cell. And if it wasn't for the fact that we had actually some small genetic bases, depending on what the condition is that the person is being admitted for, right, those might be relevant. So maybe that's what they should be angry about, is that, that there are implicit biases. I'm sure they're correct. And it's important to recognize that it filters throughout everything we do. If you look at, what I was going to tell you about your propensity to, and the $50 and the CT scan, we actually have a publication talking specifically about unavailability of coronary calcium in inner city neighborhoods in Chicago. And that $50 is nothing when I'm talking to the CEO of some company who saw me in a movie and decided to come and for a visit. But for my inner city people, $50, that's food, or it's rent, or it's transportation. This is really tough. So I'm hoping that everyone will that we learn what our biases are, remove the biases, and then race becomes relevant again. I have to admit, after years ago, and there was a discussion of this in California, I started taking it out of my notes, and I still don't put them back in. But I'm sorry sometimes that I don't have it in my notes.
Okay. Last question. Even another editorial today talked about the American healthcare disadvantage, that we actually have had a drop in lifespan more than any other Western country. But they were focusing on 2018 to 2020. It's a disadvantage to live in the United States in terms of healthcare outcomes. And they emphasize that in African American and Latino populations, the drop was the greatest of all Americans. And okay, that was data through 2020 and pre-COVID, and I'm sure it's not any better. But any thoughts, just in a big picture, why we're doing worse than Europe and why Latino and African American populations are the worst of all?
So you're gonna love this answer, Dr. Kahn. It's us. It is you writing books, me writing guidelines, and the implementation of the things that are in your books, the implementation, even our physicians, of what we wrote for nutrition in the 2019 prevention guidelines are just not being adhered to. And we have worsening lifestyles. We have another article published about television commercials. It actually is entitled Marketing Mortality. If people want to read that, just put that in your Google search. And you will see that we are feeding people through advertisement food that's so unhealthy that we're getting larger, the obesity crisis, the type 2 diabetics and 8-year-olds, the military non-readiness of our young people, and younger mortality. Cardiology is becoming more important when it should be completely almost obliterated. I always thought, and I said that when I took over as ACC president, wouldn't it be nice if in 2 generations we didn't need cardiology? I know I would, if everybody did a plant-based diet, got to a healthy weight, followed all of the American Heart Association Essential 8, okay, we would need probably 1/10 of the number of cardiologists. It would we would still have arrhythmias. We'd need EP doctors, but all the rest of us would disappear. And so we really do, and to emphasize what that editorial was saying, Jim Januzzi published about 3 months ago in JACC a projection based on the 2020 census of what's going to happen. It turns out that heart disease will go up, but it goes down in the white population, up in Hispanic, up in Blacks, and that's going to dominate the future. By 2060, it's all going to be a minority disease. Are we going to do that? Or are we going to remove all of those barriers to cardiovascular improvements in mortality just by fixing the nutrition? That's all we have to do. Fix the nutrition. Exercise will take care of itself.